Hey everyone, welcome back to the channel. Today we're diving into an important question that often comes up when working up elevated ferritin. When should you consider imaging or biopsy? Ferritin isn't just about iron overload. It can reflect liver disease, systemic inflammation, or even malignancy. So let's break it down. First up, imaging. Ferritin elevation, paired with other clues, can point us toward the right modality. If you're suspecting iron overload, think ferritin is high and transferrin saturation is above 45%. An MRI with T2 star or R2 sequences is incredibly helpful. It non-invasively quantifies liver iron and often replaces the need for biopsy in hereditary hemochromatosis, thalassemia, or transfusional overload. Ultrasound is a solid first-line test if you're looking for signs of fatty liver, cirrhosis, or hepatomegaly. It's accessible and gives a good look at the liver's size and structure, perfect for when LFTs are abnormal. Now, if there's concern for malignancy, sarcoidosis, or lymphoproliferative disease, especially in someone with systemic symptoms or unexplained cytopenias, a CT scan of the chest, abdomen, or pelvis is often the next best step. You're looking for things like lymphadenopathy or hepatosplenomegaly. And if standard imaging and labs are inconclusive, but you're still suspicious of a systemic inflammatory or neoplastic process, like lymphoma or adult-onset Still's disease, PET-CT can help detect active disease sites. Biopsy isn't always the first step anymore, but there are definitely times when it's still crucial. Historically, the gold standard for quantifying iron and evaluating fibrosis, liver biopsy is now reserved for when MRI isn't available, or when you need to look closer at other liver conditions, like NASH, autoimmune hepatitis, or fibrosis staging. If you're thinking HLH, leukemia, or aplastic anemia, especially in the setting of pancytopenia or ferritin levels over 3,000, a bone marrow biopsy can help identify hemophagocytosis, abnormal iron storage, or clonal cell populations. When imaging shows abnormal lymph nodes, a biopsy is key to diagnosing lymphoma or other cancers. It's direct, specific, and helps nail down the diagnosis. Here's a quick recap of when to consider imaging or biopsy based on clinical clues. Ferritin and TSAT over 45%, MRI liver HFE genetic testing, abnormal liver enzymes or enlarged liver, ultrasound, maybe MRI and possibly a liver biopsy, systemic symptoms or low blood counts, CT or PET-CT, and consider bone marrow biopsy. Suspicious lymph nodes, CT and likely lymph node biopsy. H. Bone marrow biopsy to look for hemophagocytosis. Ferritin is more than just an iron marker. It's a window into inflammation, liver health, and sometimes even malignancy. Knowing when to reach for imaging or biopsy can make all the difference in reaching a diagnosis. If you found this helpful, give it a like, subscribe for more clinical breakdowns, and drop any questions in the comments below. See you next time.